Good afternoon, Tom Nguyen. Own Your Own Health. We'll be right back. Well, good afternoon, Tom Nguyen. Own Your Own Health. Today, I'm really excited to share a guest that I saw in an interview and definitely wanted to have her on as a guest today. But this whole platform, Own Your Own Health, my wife and I, we have a wellness center here in our community. And my mission is to bring people in to help people to understand our health is our responsibility. And the more knowledge we have, the more information we have, the better off we'll be to manage our health through our entire life. And so today I'm really excited to bring a guest in today that will bring a new light on a topic that I think it's important everybody to be aware of. The challenge is going to create long-term for individuals' health, and that's childhood obesity. And so this platform, hopefully, I want you to tag and share today so that we have an opportunity. We never know who's going to hear this and who we're going to touch. Tag and share out there today. And without any further ado, I'm going to bring in my guest, Dr. Katrina Nguyen. And welcome, Doctor. Welcome. I'm glad to have you here today.
Thank you, Tom, for having me on your show.
Well, a whole platform, before we get into the topic, I always like to ask this question. It's part of one of my other programs I do is G-Force. G is for gratitude. What are you grateful for today?
I think every day there's always something to be grateful for. And I think I wake up every morning just grateful that I have another day to be a blessing to others and to be blessed by God.
Well, thank you. When what people really understand the power of gratitude, it even goes into the area of our health. Our mental state, our emotional state affects our physical state as well. So gratitude can be applied in every area of our life. And today with Own Your Own Health, go to a space of gratitude and notice what you feel.
Absolutely.
Just notice what you feel. So thank you for sharing your gratitude. What I like to do is just sort of, before we get into the topic and that issue is I would call an epidemic in our society, is tell us a little bit about your why, your story, and those that haven't read it on the event notification, just share a little bit about your background and why you do what you do, your story.
So I was 14 months old when my family and I escaped communist Vietnam after the war, after the Fall of Saigon. And I was the eighth child, the youngest at the time. We all escaped on my dad's fishing boat. And eventually we were rescued by a humanitarian ship, brought to the Philippines, and then flown to Guam in the refugee camp there. I nearly died during my trip, transferring from my dad's fishing boat to the humanitarian ship, and then also due to severe illness that required emergency surgery in the refugee camp in Guam. I've been a doctor for 20 years now and a pediatric gastroenterologist since 2009. And
can I ask you a question? You said a long word, so tell people what your pediatric what?
Gastroenterologist, or they call GI. So
Okay.
I take care of children's intestines, large and small, liver, gallbladder, reflux problems, constipation, nutrition, and growth.
Okay.
So comprehensive. Yep.
All right. Okay. Thank
Um,
you.
but I founded a nonprofit for childhood obesity in 2014. And prior to that, had started a childhood obesity intervention program in Augusta, Georgia. The approach and the reason why I founded the nonprofit is that I look at healthcare in the traditional setting. There's limited options on things you can do in a 30 to 60-minute visit every couple of months regarding childhood obesity. And through seeing patients and their families over time, I realized that there are many barriers that people feel and experience in developing a healthy lifestyle. So forming the nonprofit gives me the opportunity to take it outside of the office and the limitations of a hospital or clinic setting to make a difference in a different way.
How can as we go through here at the end, want to make sure people that can support you or know more about your nonprofit. We'll get that up here in a moment after a bit, but just want everybody to be aware that that you have a nonprofit supporting a great cause. It sounds like so. So, what was your driving passion to move into the medical arena? And that's a big one for anybody to go into. What was your desire or your purpose?
I would say that sometime in college, when I was volunteering at a hospital in California, I recall volunteering in the neonatal intensive care unit and seeing stories of children being sponsored from other countries and having doctors and nurses raise money and provide services to help provide surgeries and treatments that they couldn't get in other countries. And as I was growing up, I would hear the story of me nearly dying in the refugee camp and having a doctor that I, to this day, have never met, my family has never known. So I look at that as my guardian angel. And when I reflected on that in college, I wanted to be that doctor for other children because I was saved as a kid. And no matter how difficult the journey to medicine would be in my career, that was my goal. And that's really my driving force for pursuing medicine.
Okay, and you're in practice for yourself, or are what? How are you set up in your practice being a doctor? Are you in practice for yourself, or are you associated with a clinic or a hospital or anything like that?
So I used to be up until 2020. I've worked for hospitals, clinics, but since 2020, I've been independent. And in 2021, I mainly traveled as what's called a locum tenens physician. So I filled in for doctors and hospitals where needed, 7 to 10 days a month, took call and saw patients to help alleviate either doctors who left practice and there's a large patient load that remained for other doctors, or just to give other doctors relief for 7 or 10 days so they could take, some rest, vacation time with their family. And it was a big challenge after 2020 because of elective visits and surgeries, things that got delayed. And so I was there to help out with that. But I've also been building a telemedicine practice with my Catholic doctor, which covers all 50 states. We have over 100 providers. And that's what I'm working on. I'm the only pediatric GI in the group of over 120 providers.
So that is a teledoctor. A lot of health plans have it. Private plans out there have that. So, yeah, I'm not really that familiar with it. I've never used that type of service. Could you just for my clarification and our audience out there, is my mind is how can somebody advise what's going on a telephone call? Just share a little bit about what that type of service is, because I think it's important people know what it is and what the expectations are to use that type of service, if you could, please.
Yeah, absolutely. Actually, just like you, prior to 2020, I really did not provide any telehealth services. But with the pandemic, I would say 80 to 90% of our visits had to be converted to telehealth. And so many doctors, including myself, had to learn how to do telehealth and how to document, how to bill, how to selectively determine which patients could benefit from telehealth and which patients needed to come in. And even to this day, that has become an option for patients who can't travel. So I was taking care of patients in Wisconsin, and they preferred, if they had the option, to do telehealth, and that's still an option to this day. There is a convenience to it. For example, I have moms who may have 3 children and only one of them needs a doctor's visit. The other 2 have Zoom learning, um, and she's trying to prepare a meal for her family. So she's able to do all these things while taking care of the visit. Other times it's just a follow-up visit. They just want to report things are going okay and maybe they need a refill. So to drive an hour for something simple like that. But we can be very selective. In telehealth, currently, I see mostly new patients, and they want to see, do they need to drive 2 hours to get a procedure? Or is it something they can start out just screening to see if it's something like irritable bowel syndrome, anxiety related, or is it inflammatory or infectious, or something that require hospitalization or an ER visit? So it is a nice option before jumping into, waiting 3 months or driving a couple hours to see a specialist.
Okay. Yeah, because I've never been clear on that. I've been blessed. I haven't had to go to the doctor a lot in my life, and never had call an opportunity, a need to use a telemed service. So thank you for
Yes.
sharing that.
Yes, and I think like we also learned in medical school that 90% of a great visit and coming down to the diagnosis is taking a good history. So spending the time to talk to the patient, listen to their concerns, actually guides us to the possibility of 3 or 4 possible diagnoses. So not, especially for children, not most of the children don't need like a quick procedure on a first visit. It's my experience in the last 20 years.
Okay. 20 years as a doctor.
Mm-hmm.
You look so young.
I'm trying to let it show through letting my gray go, so it might impart a little wisdom and appearance.
Yeah. So you work with predominantly children with the GI, the gut issue, best way to in the lay language.
Yes.
And that's a very significant area of our health. A lot of people don't realize that our gut health is where our immune system is also resides, part of our immune system and all that. So, so critical for our health, and that'd be a topic in itself. With that, but let's sort of move to what you'd really like to talk about, and we see it, but is this childhood obesity? I hope I spelled obesity correctly.
That's correct. Yep.
But just share with the audience and those out there what you've seen and maybe your thoughts of why it's happening and how important it is for parents to take control of how to work proactively so that this doesn't become because it leads to a lot of chronic issues. And I'm let you're a doctor. I'm not. I'm just here to facilitate and ask questions. But as a doctor, what would you say is why is this happening at a scale that I would call it unproportionate epidemic?
Mm-hmm. Absolutely. And I call it an epidemic too, because actually my nonprofit called Faithful, the number 2 Fitness, our mission statement is to help reverse the childhood obesity epidemic in America. So I do call it an epidemic. In my experience, several things. Number 1 is that we need to address like the importance of nutrition at an early age. And there's a lot of commercialization of sugary foods and beverages, fast food, fried foods, things that are very addictive. There's lots of preservatives out there as well, and it's important for children and families to be educated on reading labels as they shop and understanding the importance of portion sizes. A lot of the commercials out there for food target supersizing and target children and using lots of things that are attractive in color and associating with celebrity endorsements, things like that. But certainly it isn't necessarily healthy. So we need to go back to farm to table and, teaching children and families where food comes from. So as part of my program, I actually take kids to the farm, an organic farm, and teach them these are where vegetables grow, and even understanding what certain vegetables and fruits and things look like and how to harvest them, how to clean them, how to prep something that goes from the farm to the table. And the other thing too is sitting down and eating together, preparing meals, and having children involved in preparing meals. The more involved they are in preparing the meals they eat, the more likely they're really to eat that and try new foods. And recognizing what's an appropriate portion size as well. Those things have changed over time, even including what we drink. Things that were 4 or 8 ounces, now it's like 16 is normal, and then let's supersize that to 32 ounces of soft drink. So if we do more preparation eating together, we're less likely to go through the drive-through and pick up fast food. So that's a nutrition part, but I also encourage through my nonprofit, which is to incorporate exercise and activity as a family. What I've learned over the last 5 years in particular, there's less emphasis on recess and physical education in the school setting. It's almost not a priority, and they replace it with other things that aren't as important. And so we need to bring that into the family and also back to the schools as well.
That leads to a great point that you made, because I call it the holistic. I mean, the people need to understand that our health is just not one area of that we focus in. And I call them 7 pillars. Our hydration. Most people aren't drinking enough water, and that's critical for our cellular health, and everything that our body needs is that water. Number 2 is sleep. How important that is to get good sleep, where our body can heal itself in that cycle where the cells our body's actually healing itself from the previous day. Our nutrition, and understanding the nutrition we have today is not the same nutrition my parents had.
Mm-hmm.
And so we really need to understand that our food, the types of food, the portions, and that's not for me to really get into, and then our supplementation, because we need our minerals and we need our vitamins that maybe food isn't. So understanding good nutritional supplementation by being educated. Then exercise, you mentioned it. When I grew up in school, we had recess and we did exercises and jumping jacks and ran and played sports. And in high school, it was you had gym and class.
Mm-hmm.
Today, I don't know what that environment is, that people are sedentary. I mean, adults, but children today are even probably more sedentary than when I was a kid. I was encouraged to go out and play in the woods and the creek and run around and all that. Today, I don't see that as much. So exercise.
Mm-hmm. And there are many parents that will ask me to include their children in my program because they have no option in school to keep their children active. Not every parent can afford to enroll their kids in sports that are out there and programs, that even involved in the school. So, they reach out because they're concerned that if without encouraging their children to be healthy and active when they're young, is this a habit that they can develop later?
Yeah. So being a parent, we have a lot of responsibilities raising children. And I think when it comes to the health, I think we're going to talk about the obesity thing, and we'll talk about how critical that is for the the things that will arise down the road that if you don't get a hold of it. Is I think it's lifestyle, and I think parents need to be the example. It's I always grew up with this. Kids are going to do what they see, not what they hear. So parents need to be the example of eating right, educating their children, exercising, getting the family involved. If you mentioned something, they maybe can't have the time, money, or their other resources, but families can do things like after dinner walks or Saturday morning walks or exercises or bicycling together. There's a lot of things we can do. It's not always the sport side of exercise, but just that movement is so important.
And I'm one of 10 kids, and none of my siblings were enrolled in sports, but my mom, she passed away at 86, and she had her own treadmill, and she would run the treadmill 30 minutes every morning. And she would take walks with us, even morning or night. And she would always say, "You want to go to the park?" And there was just finding time to be together. And those are the walks where we had meaningful conversations that we have memories from those things. So nowadays, my sisters and I, when we get together, we do walks. Just like last week when I was on Thanksgiving break, my sister and I walked 3 times, and we're like, oh well, after that walk, we did 12,000 steps together, and just trying to balance all the holiday eating and stuff. I think that's important. It's a habit that it's instilled, and there's joy and that you have through that experience of walking. Doesn't seem like it's exercise because you're actually spending quality time with someone, but it feels good afterward. And the other thing I was going to mention in my program is that we do require family participation. So unlike sports where children get dropped off or parents and grandparents are watching from the sidelines, we require that parents and grandparents, guardians, siblings work out with the children, prepare meals with us, go to the farm with us, go grocery shopping with us. So these are all things that involve the whole family, not just the child.
Yeah, it's a lifestyle. It's demonstrated, and so let's take a look at what childhood obesity, what you've noticed, children. What's the first sign of childhood obesity? I guess it'd be body mass and all those type of things. But what would a parent should be? Is my child normal in weight, or are they going to outgrow that to have a growth spurt? What are the real signs that would cause a parent to be concerned about obesity or a weight issue? And what does that really mean?
Sure. So this question comes up from a primary care perspective versus a specialist. So I spoke to family physicians, the past few years, and they struggle with bringing up the topic even in the office. So I always say that if we look at the growth chart of a child at every visit, whether they're there for a well visit or a sick visit, and the trajectory of their body mass index, it's not a perfect indication of obesity, but it gives you an idea. Are we jumping from 25 percentile to 95 percentile quickly? Certainly body mass index of 85th percentile or higher, then we get concerned about what we call overweight. Anything above 95th percentile is in the range of obesity. As a specialist, I actually don't see children for well visits regularly, but more for sick visits or referrals. But I usually will see children for obesity-related health problems because of fatty liver. So a primary care physician or an endocrinologist who sees children for type 2 diabetes and other conditions like thyroid or type 1 diabetes, but certainly type 2 diabetes, will follow liver enzymes and refer them to me to evaluate for what's called fatty liver disease, which is one of the most common liver diseases now in children that if untreated, which is diet, exercise, and losing weight, can lead to harm to the liver, even liver transplant, cirrhosis, similar to other types of liver diseases like hepatitis B and C. So it's not something to just say, oh gosh, it's just obesity. It can lead to other more devastating health problems. But many children that get referred to my program, they also struggle with type 2 diabetes. And they get on medications and insulin, and they have to check their blood sugars frequently. So if we can help them in terms of changing their diet and exercise, being more active, being more aware of what they're putting in their body. Imagine as a teenager the joy of getting off insulin or cutting back on their medications because they're making interventions in their health very early on. They're owning their health along with their family.
So a lot of this is changing habits and behaviors and belief systems and all that. What do you do to help a parent first? Let's start with the parents to understand the severity of it. You got it. I guess the best way to do it, I'm sort of a personal development coach. What does the worst outcome look like? And do you want to go there? No, I don't want to go there. So what can I do not to get there? How do you approach that with a parent in a way that without freaking them, I guess the best word is startling to a point where they're get frozen, but or
Yeah.
freaking them out. But how do you work with the parent to get them to understand the severity of it?
Well, I think as a specialist like myself who sees fatty liver disease and knows the consequences of that, both for an older child and an adult, I always present it as worst case scenario. So, if we talk about worst case scenario, I think that gives perspective on do we have an option in children to prevent that progression. So why not do it now? When I was in my residency training, I actually did a combined residency with internal medicine and pediatrics. So I took care of adults as well. And I said, why wait till you're 40 and having a heart attack and going through surgeries while you can prevent that? So I always give that perspective to parents. And I think the other thing too is we recognize that we can, as physicians, present the information and the perspective, but what it requires is at some point both the parent and the child have to come to a point where they are willing to make the change. As the title of your show says, own your own health. They have to take ownership of that. This is an issue that needs to be addressed so that we can make one change at a time. Because if we change nothing will change, right? So pick one thing, pick nutrition, pick exercise, pick sleep, pick something and start there.
Yeah. And so now you're dealing with the parent and getting them to learn how to communicate differently with their children by example and encouragement and all the things necessary to change. How do you deal with a child that has can't comprehend the outcomes, what that does? Or how would you communicate with a young person to start bringing the awareness of what they're doing and what that could look like to them, and how do you deal with that child?
Well, I think in the same way that we, talk to the parents, we talk to them as a family and giving, again, I'm like a straight shooter. So I just give the worst case scenario. So I don't just say, hey, it's just obesity and here's your weight and it's fatty liver. It said, well, if we don't treat this, it could lead to liver cancer. Is that something that you would want to see yourself 10, 20 years from now? And sometimes for the child, even that isn't good enough, but it will at some point. I've had children who parents would want them to be enrolled in our program or go see a doctor or see a dietitian. Maybe a year ago or 2 years ago, they weren't ready. But 2 years later, they reach out and say, I'm ready now. And that's something that we can only put the seed of information and a little bit of encouragement, but we have to get to the point where the family can be on the same page. Otherwise, no matter what intervention or knowledge, education we provide would not be effective until the family is ready.
Okay. So when did in a timeline going back, you've been in the medical arena for 20 years. When did you really start seeing it really spiking? I guess it's always been a problem to some degree, but in the last 10, 15 years, what have you seen the amount of childhood obesity?
I would say, so I finished my pediatric GI fellowship in 2009. And prior to that, in my residency from 2002 to 2006, I didn't see as much fatty liver disease, but certainly in my fellowship, I started to see a rise. So from 2006, 2009, when I went to Georgia, that was my first job out of fellowship. That was when I recognized that, gosh, we need to do something. And I had partners there who, wanted to start an obesity intervention program in the hospital setting. But there were a lot of challenges because, believe it or not, a doctor may want to see and evaluate and treat and counsel a patient for childhood obesity. But at that point, the insurance companies wouldn't cover it if we said we were seeing a child for the diagnosis of obesity. We had to have some other health problem associated with that, like, type 2 diabetes or sleep apnea or something else. So, I would say not everyone is altruistic. Let me do this for free, right? So many people in healthcare say we have to, especially in the hospital setting, like we have to get paid for what we do. But as far as for me, I said, if I want to make a difference, does it have to be in a hospital? If we're struggling with the red tape and getting payment, so I took it outside and created the first obesity intervention program there by saying, let's partner with gyms that offer free exercise classes every week and a fitness instructor. Let's partner with grocery stores and let's take kids on grocery store tours and have a dietitian teach them nutrition lessons interactively. Sitting down and bringing in calorie counts for 3 days, looking at what they eat, and maybe being honest and say, these are the things I buy. Can you help me read these labels and see maybe I can make better choices? Meal prepping in a restaurant with a chef and a company that could teach us 3 or 4 ingredients to prepare a meal that takes 30 minutes or less, and getting children and parents involved in that. And so I didn't need anybody that got referred to me that they had to have a particular insurance for me to help them, right? They didn't have to schedule an office visit or get weighed every week. And I took away a lot of the barriers that people felt about coming to see a doctor for this health problem that most people, adults or children, don't even want to discuss. But when it's not in a formal setting, but in a more interactive, friendly environment where I'm part of the exercise class, my nurses, my medical students were there to help motivate the families, and we're working out together. And that's what I enjoy the most. I say, I need to exercise anyway. Why not show up with my patients and other people as well?
That's beautiful. That's, you said something there too. People are crisis care. I don't even call it healthcare system we have. It's all about when the symptom shows up, then we will do something versus preventively. In most cases, I'm not saying across the board, but so people, the traditional goes to the doctor. Well, we can't submit it for insurance, so we'll wait until something happens and then we'll submit it. That doesn't make sense to me. Is that sort of what you were saying there? I mean,
that was what was going on back in 2009, 2010, and to start like an obesity program, it was just like, well, how are we going to get this covered or paid for, or so that was the struggle. And I just looked at it and I said, aren't we all here to help patients? So does it really matter if this is something we want to help in this setting or outside? So that's where my idea of a nonprofit for childhood obese started.
Let's talk about your nonprofit. I think you got some information. I'm going to bring up some banners here so people can go to your website, learn more about you, what you do in more depth. Let me bring up my banners here. Let's see. This is your website. When they go to your website, what will they see there as far as your background, services you offer?
So mdkatrina.com puts together my work as a doctor, as an author, as a speaker, and as a nonprofit founder. So under mdkatrina.com, if you click on the symbol for nonprofit, it'll lead you to faithful2fitness.org, which is my nonprofit for childhood obesity. And it's been around since 2014. Basically, it's based here in Rockford, Loves Park, Illinois. And we offer 2 to 3 12-week programs per year. We have many partners in the community that help us provide free exercise classes, nutrition programs, cooking classes, farm visits, grocery store tours, and we have many volunteers through the medical community, such as dietitians, medical students, nurses, and medical assistants, fitness instructors, and also farm instructors through the Angelic Organics Learning Center. Our grocery store is Meyer here in Rockford, and then our gym is Peak Sports Club in Loves Park. We have other partners that help design our website, like Astute Web Group, and we have attorneys that have helped me set up my nonprofit status, as well as the trademark for my nonprofit. So, and all of them have done it for the most part pro bono. It's about contributing time, talent, and treasure. So not a single person that serves in Faithful to Fitness is paid a penny for the services they do. And they take pride in the fact that they're making a difference in the future of children's healthcare by helping me make this possible. And my hope is that we can expand this and give somebody else out there who's passionate about childhood obesity intervention an opportunity to help me create a chapter of my nonprofit in their city or their state, their community.
Okay, well, so you have a big vision and purpose, not just in your local community, to reach out there. So people out there that have an interest in childhood obesity, bring their talent, treasure to it, and build. I guess you want to build different chapters and replicate and duplicate that cause.
Yes.
And that's where they would start going there to find out more about.
Yes, they can go there. And then I also, they can connect with me through my website and just schedule a 30-minute consultation for free, just to discuss what resources are available in their community and how I can help them build the same program, but just using resources they have in their community. For example, I do presentations through continuing medical educations for doctors, nurses. And they always come up, a lot of people come up and say, oh, I wish I could have this in my community. And I say, well, we need to find somebody passionate who can lead it. So my husband always says, you can't be in every community. And I said, but we're going to find people like me and my dietitian and other volunteers who can do it. So, there's a hospital in every community. There's a medical school in almost every community. There's gyms, there's grocery stores. There's dietitians, right? We have all the pieces. It's not unique to Rockford, Illinois.
Yeah. So your mission, or your hands-on in your community there, building this out. You want to build this into, network it out, and but a lot of people are seeing this or virtual or across the country, and do you offer services for those that telephone conversation, guidance, programs on your website, education, those type of things for people to touch base with you, to do it on demand, teaching, or anything like that?
Yes, certainly if they want to connect for a telehealth visit as a patient, you can do that through mycatholicdoctor.com. Or if you just go to mdkatrina.com, it has all the things. If you want to reach out to me as a patient to doctor, you can schedule a visit. If you just want to talk about my nonprofit and how I can help start a chapter in the community, that's also possible. So everything is on one page, and it's really easy to go there and see, oh, these are all the things she does. How can I connect with her for this purpose?
Well, great. Because our whole mission here at Own Your Own Health is getting the word out, finding the resources, be a contributor. How can, we look at many times as institutions to take care of everything, but I think owning your own health is we got to work as a community as well. Would you agree?
Absolutely. And I think that each of us, whatever business you're in, you can make a difference in healthcare if you choose to use your talent and treasure and your time in a way that makes an impact. So a lot of us go through our life thinking about how can I make an income and how can I make more of an income? But I think if we focus on how can I make more of an impact, I think the income will be there. And I think the long-term impact that you make in your community that's something people will always remember you for. And that's what I would like to be remembered for when my time on earth is gone. So, um,
Wonderful.
yep.
As a personal development coach, what you just said there is, I think it's important in life, is know your purpose, passion, and why, and everything will align with that vision that you have, and including your health. You don't have a clear picture of what health looks like, feels like, all those things. Many times people don't know what health is anymore,
Mm-hmm.
because we are under the influence of poor diet and the foods that we eat that are not, we all know, are not doing the best for their health. And many times we don't know what it feels like to be healthy.
Mm-hmm.
So
Yep. And I think the other thing I wanted to mention is that, going back to kind of my story, my family story, why it's so important to reflect on giving back to help improve people's lives and their health, mental, physical, spiritual well-being, is that, I'm blessed to be here as a Vietnamese refugee and all the opportunities that I've been given to be able to do all the things I do. And that's why when I recruit people to do volunteer work for my nonprofit, I always remind them of how many blessings they've had in their life to get to where they're at. And if we think of that, as you mentioned, in gratitude every day for how far you've come. If we can focus on our blessings, we can in turn use our time, our talent, and treasure to bless other people in the work that we do.
I love when I heard your interview with Raja, and I says, I definitely have to have this woman on Own Your Own Health, because our health, like you said, we got to own it. We got to take responsibility. We got to be informed, take action, be an example for our children and our family, and to take our gifts and talents and to share it with other people. Share the good news. This is what I found out about childhood obesity.
Mhm.
Share that out, because we all know families. You don't have to look far, right, to see the problem.
Mm-hmm. Absolutely. Yeah.
And so I love your mission, your purpose. I think that's as much important as the how-to things that you do
Mm-hmm.
with your patients and that.
Yeah. And I hope that I can reach someone out there that will say, hey, I want to do that for my community. Can we talk? And I can do a 30-minute conversation, and then I can even go out to their community and inspire other people just to hear how far Illinois has come in this area to make a difference in our community.
Well, I'm up here in Oconomowoc, Wisconsin. We're probably 70 miles away, 80 miles, something like that. So definitely want to maintain our relationship and our communication, because my wife and I, we have a wellness center, and there might be an opportunity. Maybe we can chat about that and maybe do a workshop in our community to get people aware of the challenge, because we all know somebody that has some sort of challenge with their children,
Mhm.
with obesity and that. So I love what you're saying, and you're making a difference in the world. And I'm glad you're able to make it here.
Well, thank you so much. Yeah.
Yeah. In closing, I'm going to make sure I go through your banners here again, make sure that everybody is aware of how to reach out to you. But in closing, and this may not just apply to children, but in health in general, what would you say to somebody to bring them to a level, what I call it, to a level of awareness, so that I can avoid things that down the road that we see all the time? What would you say to get them to take action?
I think,
I don't know if I asked that question in a way that made sense, but
yeah, that's okay. I think that if I sit down with a patient or family and I say, let's say 20 years down the line, where would you want to spend most of your week? You want to spend it in the hospital, seeing doctors, nurses, or do you want to spend it with your family at home and traveling, making memories? So that's what we have to look at. If we're healthy enough 20 years down the line, to be able to do things and enjoy life versus spending time taking care of diseases. So that's a perspective that if we make a difference now and intervene and make changes, we can make an impact on how we see ourselves 20 years from now. I'd rather spend my time making memories and traveling and enjoying life rather than going doctor visits. So
Yeah, absolutely. I
and
think
that's
that
me as a doctor. So
yeah, our wellness center is on a campus of assisted living and independent living and that type of environment. And I look at some of the people on the assisted living side and the state they're in and health wise, and age has a lot to do, but a lot of it is could have been prevented.
mm-hmm.
And I look at that and I say, I do not want to be there. What can I do not to be there? Doesn't mean I won't ever be there.
Mm-hmm.
But if I can create a lifestyle that allows me to keep up with my grandkids and all those type of things, the things we all desire. I'm 72
mm-hmm.
and, I can run around with those 35-year-olds. But I made a decision
mm-hmm.
to take care of myself so I can do that. Because I know a
mm-hmm.
lot of people in their 50s and 60s that wish they could, and they can't reverse where they're at now. So,
mm-hmm.
but I love the fact that you have a vision and a purpose, and that we're dealing with a situation called childhood obesity, which leads to all the other health issues that just stack up on top of each other. So
yeah.
I'm going to bring up your banners and we'll just talk about them real quick, make sure that everybody understands what we have here. This is your email. They can
yes.
reach you directly, any questions they have. This is where your Catholic doctor, you can schedule a free consultation to meet with you on questions there. Is that correct?
Yes.
And this is your website?
Yes. And that's where all 4 things I do: doctor, author, nonprofit founder, and speaking. So
wonderful.
Any of those interests, you can reach out to me there.
Well, it's been an honor to have you on. As a layperson, I see that we live in a culture of people. We have more chronic illness than ever before, and it can be prevented if we have full knowledge. And I believe that's own your own health, work proactively, ask the right questions from your medical provider, and know that there's alternatives out there as well. And so that's part of what we do here.
Yes.
So, Doctor, I appreciate that you've taken some time here today out of your busy schedule, and I'm going to put you in the back room. Excuse me, and just hold on for a moment while we close out. Okay.
Well, thank you very much.
Let me do this. I want to make sure Dr. Katrina Nguyen. Reach out to her. Go to her website. She's got a great mission to do, not just taking care of patients and families and helping with child obesity, but to take that message to a bigger platform. Anybody that's out there hears this, reach out to her. It's all about collaboration. It only starts with one idea and getting other people to see the vision to solve a problem out there. So don't hesitate to reach out there and help the cause that she's pushing out there. So without any further ado, I just want to say thank you for everybody for being here. Robert, thanks for all your comments. They were coming fast and furious. I couldn't keep up with it. I want to thank all those that came in today. Tag and share this information out. And everybody have a blessed day. God bless.